Good morning and welcome to our Trillium Health Resources April Provider Forum. Next slide. My name is Linda Holly Isbell. I am the Associate Vice President of Provider Relations and Engagement and Provider Support Services, and I want to welcome you to our meeting today. We have a very full agenda for you. We're going to start off talking a little bit about Trillium's tailored plan. We will have a demonstration of the provider directory. We'll talk about non-emergency medical transportation, how to identify a member's care manager, how to submit IT tickets, and some information about Provider Direct. We'll discuss third-party billing, individual placement and support. We'll go to our next slide. Expedited appeals criteria and designating an authorized representative for an appeal. We'll discuss essential information for physical health providers, personal care services billing guidance. We'll talk about a new provider survey coming up. We'll go over some resources for you, and then we'll have a time for questions and answers. Again, I'm Linda Holly Isbell, and I want to welcome you today. I just want to start out by giving some high-level information about Trillium Health Resources. We are a managed care organization that manages serious mental health, substance use, traumatic brain injury, and intellectual and developmental disabilities in North Carolina. We also work with individuals receiving Medicaid through the tailored plan. We cover physical health care, and pharmacy services as well. We also help uninsured individuals through state-funded services. This map shows the 46 counties that are part of Trillium Health Resources. You can see the information about the landmass and the population as well. Currently in our network, we have 54,105 physical health providers across our 46 counties, and some of them in other counties of the 100. We have 14,103 behavioral health providers, 452 vision providers, 2,788 pharmacy and medical supply providers, and we do cover all 100 counties with these providers in our network. During the meeting today, you will have an opportunity to ask questions in the through the Q&A icon. Our subject matter experts will be responding in the Q&A icon throughout the meeting. If there are any questions that require more research, we will take those back and they will be listed in our frequently asked questions document that's posted on our website. We will also have a time at the end of the presentation for live questions. Please note the use of artificial intelligence, AI, features including but not limited to programs and/or apps to assist with transcription and/or recording during any Trillium WebEx meeting is not permitted. This meeting includes the following features: recording and transcripts and highlights. This slide shows you how you can find the Q&A icon. You type your question in, and our subject matter experts will respond to that question, so the answer will be right at the bottom of your question. Again, we will have a time at the end for live question and answer, and we will post this provider forum PowerPoint on our website. Excuse me. So let's talk about how we got here with the provider forums. We are really excited to have started these in February of this year. We started out in the fall of 2024 by conducting a survey to collect data from each of you, all of the providers in our provider network, to find out what information you would like to receive technical assistance and education on. On this slide, you see the top 7 topics that came out of that survey. Today, we will complete the demo of a provider directory And then on May 14th, for that provider forum, we will do a presentation on our TBS system setup. That will complete the top 7 topics that our providers requested that we speak about. There are also other topics identified in the survey that we include in each of the provider forums. We also include any hot topics that come up between the meetings. Now I'll turn it over to Chauncey Dameron.
Thanks, Linda. I'm going to review some of the tailored plan partnerships that Trillium has. Next slide. First off will be Carolina Complete Health, which is Trillium's standard partner and their standard plan partner, and they're responsible for our physical health network, including primary care, specialty care, durable medical equipment, vision, long-term services, and supports, non-emergency medical transportation, and non-emergency ambulance transportation. Next, we have Centene Vision Services, and they're our vision partner, which is formerly Involve. And through our agreement with CCH, they're responsible for our optometry network. Perform RX also is our pharmacy benefit manager partner, and they're responsible for our pharmacy network. We have Motive Care, which is Trillium's NEMT partner, and through our agreement with CCH, they're responsible for our NEMT network. And then we have North Carolina Department of Health and Human Services, which is Trillium's oversight entity, and they're responsible for managing delivery of health and human service related services for all of North Carolinians. Next slide. I'm going to now turn it over to Julie Kokocha, and she's going to talk about the provider directory.
All right, thank you, Chauncey. This is Julie Kokocha. I'm the Associate Vice President of Network Accountability, and one of my team's role is to ensure the provider directory is accurate, complete, and help assist providers with the directory. Next slide, please. Okay, provider directory availability. So Trillium's provider directory is available both electronically and in a paper version. Second, for the electronic provider directory, you can find that on the Trillium website. And at the end, when I do a demonstration, I'll show you exactly how to navigate to find the electronic provider directory. Electronic provider directory is searchable, and the results can be saved and also printed if needed. We also have the Trillium's printed provider directory. And members can request a paper copy through the member and recipient service line. The telephone number is there. A paper copy is available and can be sent to members without any charge whenever a member requests. Some key points about the directory to highlight. The provider directory lists all fully contracted behavioral health, IVD, physical health, and pharmacy providers by sites. So it includes both the physical health and the behavioral health providers that are fully contracted by each individual site and location. The provider directory is updated daily, and we have approximately 85,000 provider listings. The provider directory displays information supplied by providers via the NC Track system. So the data that is displayed in the directory is sourced from the provider profile in NC Tracks. So the data points that the providers are enrolled in NC Tracks and the key demographic information, contact information comes from the NC Tracks system. Providers must maintain and update their data in NC Tracks for all directory items except 2 data points. So there are 2 items that are listed on the provider directory website, and if they completed cultural competency training. Those 2 data points, Trillium, all the tailored plans, and the standard plans are able to edit if needed. All the other data points is maintained in NC Tracks, and that data flows into our directory as well. So that's why it's very important that your data is updated in NC Tracks, because that is for every data point except 2, how it flows and displays on our directory. Okay, the electronic provider directory resources. So you'll see when I share my screen and bring you to the Trillium provider website, there are some resources that may be helpful for you or members that you support. There is a demo video. That video is on the website and walks you through with screenshots about how to navigate the directory. There's also search tips that's located on the website, a glossary of terms. There's options to report issues, so I'll show you when we share my screen and walk through the directory how a member can report an issue, or you as a provider, if your information is not correct or if you have a question about your listing, you can report it directly from our website, and I'll show you those options there. And then also there's an export to print feature, which allows users to save a copy of their search. So you can secure that, save that for future use, or print it if necessary. So I will walk or by option B. It's dependent on how you would like to search. So there's two different ways. Option A, a user can find a provider by searching by a specific provider type. So if you know which type of provider you're looking for and want to narrow your results, you'll use the provider pictures and click the next green, the green next bar. You also can skip any of these filters and navigate to the next screen. So if you're very confident that you're looking for a behavioral health facility, you can click to the next and you'll only get results of providers that are in that category. So it just narrows your search options. And then option B, a user can skip all the search pictures and view the entire provider directory by clicking click for full provider search. So if you want to cast a wider net for the providers that you are looking for, if you want to ensure that you are all inclusive of your providers, if you're unsure exactly what category you need, you can click for the full provider search. And you can, when you get to that page, narrow some of the parameters down to drill down to exactly what you need. Okay, so the electronic provider directory location, this is a link specifically at the top to the Trillium website. And if you click on the purple Find a Provider box that's located on the top right side, that will bring you to the directory. That purple box is located on every page, no matter where you navigate, it's at the top. So no matter what page you're on, you look for the purple provider box, and that will bring you to the directory itself. Okay, so today I'd like to demonstrate a few items from the directory, and then I'll also show you how, if you have additional questions or you want to confirm some of your information, how you can reach out to Trillium. So today I'd like to review, I think the PowerPoint just went away. Can we bring back the slide? Okay, I just want to review the demonstration, just highlight. So I'm going to review the basic layout of the provider directory. I'll walk through the layout of the directory. Next, I'll detail the search options, outline the key features of the directory, and illustrate an example. So now I'm going to navigate to the Trillium website, and I'm going to share my screen. So you should be viewing the Trillium website. So I'm on the main page of the provider of the Trillium website. And we'll see purple box Find a Provider. So I will click on Find a Provider. This brings me to the provider directory page. So here are some of the resources, your search tips and language assistant. This is the member recipient services line, so members can easily find the phone number if they need to reach out and get additional assistance. This is our glossary, instruction, and search tip sheet. And then here's the provider directory demo. So this is a 5-minute, 42-second video that you can find on our page that will navigate and show you screenshots live how to navigate through the directory. So as I mentioned, these are option 1, or A, is searching by the provider types, and these are the pictures. So option 1 would be if you know what specific provider you're looking for and want to narrow your search, you will highlight, you'll see the green box that tells me, yes, this is what I'm clicking on, and I can click next. At any time, you can just skip the step and go to the next step. So I could click on behavioral health, click next. If I want to narrow my search even further, I can narrow my search behavioral health facilities, or professionals. If I want both, if I want to include in my search results behavioral health facilities and behavioral health professionals, I can skip that step, and that will include both of those different categories. This is the next tab, which is location. And here you can enter your street address in this box. You can also put your zip code that you're looking for the provider, or select a county. This is a drop down. There's all 100 counties in here where you can search, or you can use your current location, and then you would click next. And just some key points. These are a list of providers who serve Trillium Health Resources members. It's updated on a daily basis. It's based on details submitted by providers and how members can request a copy, a paper copy, also the phone number if they need assistance. We also provide the department with a copy of both the electronic and paper version whenever there's a change, and also annually. And any provider who cannot receive payment from Trillium will not show up on the directory. So if a provider payments suspended or terminated, they will not be displayed in the directory. So that is the first option. I'm going to go back to the beginning so I can show you the second option. So as I mentioned, you can filter by the pictures. If you know, there's a description that tells you what providers are included in that category. If you want to review by the entire directory, you'll scroll to the bottom here and click for full provider search. So this will pull all 85,952 providers. Of course, most providers and members would want to tailor their search. So this is where you would use some of these search criteria. So I'm just going to walk through some of them. So you can search by the provider name or keyword. So if you know the provider name, you can type the provider here and then click apply. Search by NPI number. So for providers, if you want to confirm your information is correct on the directory, you can search by your own NPI number or provider NPI number. We have medical group affiliations. That's required for our accreditation. Specialty. So this is actually the taxonomy code that the provider is enrolled in NC Tracks. So as a provider, your specialty taxonomy code is how you'll be searched. What you have indicated and enrolled with North Carolina Medicaid, the specialty. Insurance plan, plan accepted. This can further narrow if you're only looking for state-funded providers, Medicaid tailored plan, or direct. Languages, if there's a specific language that you want to filter by. And then we also have the location on the big page, the full search page. So you noticed on option A, when you're searching by the provider tiles, you can search by location. On the full search, you also can search by location. So again, same as the other tiles, you can enter your address or your postal code. You can clarify and narrow how far out you want your search radius from that location or postal code. You can search by a county. If there's other information that you only want to get results, you can click the button here, whether the provider is accepting new patients, if they have cultural competency training, if it's a clinician, provider, practitioner, by their gender, primary care provider, or tailored care management. And then you would search all your filters and then hit apply. At any point, you could start over for a new search or clear those filters. As I mentioned, there's a print results tab here. So I'll show you when I walk through one of the examples how you can print or save your results. Filter by letter. So if you're looking for a certain provider and you search for urology and you know the beginning of the provider's name, you could click on that letter and it's going to bring you those providers that name begins with that letter. And then you can remove that filter there. So I'm just going to walk through some of the data points that are in each provider profile. So I'm just going to start with the one that starts with the numbers 108 Medical Inc. I'm going to click the more information to open up, and you'll see the provider type. So this is all from your taxonomy code in NC Tracks, other managed care category provider, the location. You can also click here to get the directions. It'll include the address and the county. These are the hours of operation. You'll have a green check or an X. The green will be yes, that's a positive, accepting new patient. This provider does not have these items, so it's grayed out with the X. Contact information, providers required to have their phone number, their after hours, and their fax. And these are all the numbers that are displayed and captured in NC Tracks. Mailing address, doing business name, if there is one. If not, if there's any information that's not contained in NC Tracks, then it'll be an NA. So that means that information is not entered in by the provider in NC Tracks, so therefore we cannot display it. Last validated, so this is when the data, each day, as I mentioned, it's updated, so you'll see that date there. If the provider has a website, 3-digit location code, gender, and of course for facilities and provider agencies that's not a clinician practitioner will be an NA. Languages, fidelity evaluation scores, so these scores are for IPS and ACT fidelity, so for most providers it'll be an NA. NPI number, any accessibility the providers indicated in their profile, insurance or health plan accepted, their disciplines, any specific indicators were required to identify if the provider is an essential provider and if they're tailored care management provider agency. This is the effective date. This is the date that the provider has indicated that these are their profile. Any affiliations, any specialties, population served. So if the provider is indicated in NC Tracks, the population that they serve and the age range that will display, and then source. So this is, as you heard mentioned earlier, our different partners. This is where the data is sourced. So for this, Carolina Complete Health has set this provider's name on the file as contracted to serve Trillium members. Report inaccurate or validate provider information. So as I mentioned earlier, there's a way for you to share information directly with us if your information is incorrect or if another provider's information is correct. So for members and recipients, you can click this, send us an email. This will open up to your email box and you can send an email to Trillium Provider Directory. Also, they can call us, members can, at the member and recipient service line. For providers, you can also send us an email. It's the same email address here for Trillium Provider Directory, or call the provider support service line. So if you have any questions about your profile, any issues, you can send an email or call the provider support line. So I'm going to go through and just walk through one example here. So I'm going to search, I'm not going to search all the criteria because it will take some time, but I'm going to search through the specialty. This is most where providers will find the taxonomy code or specialty that the provider is enrolled in Medicaid. So you can search as alphabetical. So I'm going to look for a urologist. So I could just scroll down to the U's. And there are some subcategories of the specialties. So when I get to, sorry for the scrolling, urology, for the specialties taxonomy codes that have a second level, you'll see this drop down. So there's providers that have a specialty code or taxonomy code for urology, and then another level 2, a female pelvic medicine and reconstructive surgery, or pediatric urology. If you want to include all, you would just click urology and that will include all of them. So if I'm looking for a urology provider and I'm going to say Pitt County, so I'll scroll down to the Pitt County, and then if there's any other features I'd like to add, be sure that they're accepting new patients, or if it's very important to me that they've had cultural competency training, I can also search by that. If I want to be sure that the provider speaks Spanish, I can check that. Just for ease of navigation, I'm just going to put 2 parameters for urology. So I want to note you can use the drop down or begin to type. So I could just start typing, and anything that includes these letters will show. I'm just going to click urology, and then I'm going to click apply. And then it will tell me that these are my search results. So I have 31 total of urology providers in Pitt County. As I mentioned, if you know the beginning of the provider name, you could click on that letter there. So if I know I'm looking for urologist and the name begins with an M, I can click the M and there's those providers. Go back. It will show you, this is a listing 1 through 10 of 31. So so if you want to look at additional results, you have to scroll to the bottom and go to page 2, 3, or 4. So these are the providers that have the taxonomy code of urology in Pitt County. The demographics are exactly the same. It also will show you the provider affiliations, so the practitioners affiliated with multiple organizations. You will see the organizations here, and you can click on that and it'll open. And these are the agencies that this provider is affiliated with the address, the city, the state, the phone number. If I want to drill directly to that provider, it's a hyperlink and that'll bring me to this provider. And also, screen, you also can report the inaccurate or validate your provider information. So this is my search option. These are my 31 providers. I can, if I'd like to save this and share it with others or refer to it later. The directory is updated daily. It comes from a daily provider network file from NC Tracks. So as information is updated in NC Tracks, the next day when it comes to for Trillium, it will be displayed in the directory. But I can print my results. I'll click on this button here. And it's generating the PDF here. Okay, and then it'll say your PDF is ready. Click the download button to download your PDF, and I can click here, and it's going to display the header that's on that page. And it also will tell you the date of printing. It will have the date and the actual time, because as I mentioned, it's updated daily and may change. So you can, when you pull this information, you'll know when it was last validated. And then it has all the same information that you will find on the electronic version. And then if you want to start over, you can go back to your search results, and it's going to bring me back to the 31 providers that I viewed. Okay, so I'm going to stop sharing my screen and move to the PowerPoint. Okay, thank you everyone. For the next slide, I'd like to turn it over to Katie Hewitt.
Hi, good morning. My name is Katie Hewitt. I am the head of our practice management team here at Trillium. And I am going to present today on individual placement and supported employment. Next slide, please. So for this first slide, I wanted to talk a little bit about employment first. In March of 2019, Governor Cooper signed Executive Order 92, declaring employment first for North Carolinians with disabilities. Employment First is a national movement that recognizes all citizens, including individuals with significant disabilities, that all citizens are capable of participating in integrated employment and community life. 1.3 million of North Carolinians have a disability, and only 5% of those individuals are employed, compared to a 76% employment rate for individuals without a disability. I want to share a little bit about the benefits of employment. Employment is recovery. It helps us all have a valued social role and community inclusion. It creates daily routine and structure. It helps to build natural supports. Our friends tend to be the people that we work with, and we work really hard in the work that we do to ensure our members have natural support. So getting them employment, connecting them with an employer is a great way for them to build that network. It gives folks a sense of purpose and contribution, and there are financial gains to working as well. So this is an overview of IPS SE services. It is state funded, and it's funded by 1915I Medicaid. We are going to focus mostly on the nuances related to 1915I today. We do have state-funded providers, but we're going to talk about a care plan and a 1915I assessment. The state-funded services would not need those things. The 1959 clinical coverage policy for IPS supported employment is 8H-2. IPS SE is an evidence-based model that was developed by Dartmouth. And evidence-based means our providers have fidelity reviews. So they are getting reviews usually annually to measure how well they're performing and how successful they are at helping individuals gain and maintain competitive integrated employment. The IPS team assists individuals with SMI, SPMI, and/or severe substance use disorder in choosing, acquiring, maintaining competitive integrated employment in their communities. IPS SE is person-centered with a focus on employment. Education supports are part of IPS services, but it's only when the educational program is related to a person's career goal. So IPS will not be able to help someone who wants to do cooking classes just to learn to cook better for their self at home. But if they want cooking classes to support the person who's trying to become a chef, the IPS provider can help support that member in those classes. IPS is not a clinical service. The teams partner with behavioral health providers who support the individual's clinical needs. And then something really unique about IPS is that it's funded by NC Core milestones. And what's tricky is that the milestone information is not in clinical coverage policy 8H-2. So that is somewhat of a gap because the policy is the DHP policy, and the NC Core milestones are not listed in that policy. So go ahead to the next slide, please. So the clinical coverage policy 8H-2 entrance criteria, the individuals have to be 16 years of age and older, one or more of the following diagnoses, so severe and persistent mental illness, severe mental illness and/or severe substance use disorder. They have to have expressed desire to work and have one or more of the following: an established pattern of unemployment, underemployment, or sporadic employment, or educational goals that relate to employment goals, and a need for obtaining assistance in obtaining and maintaining employment in addition to what's typically available from their employer. Please note this is not service for IDD individuals or individuals with a TBI diagnosis. They would have services under a different clinical coverage policy for supported employment. It would be clinical coverage policy 8H-1. Next slide, please. So our IPS team composition, we have a team lead who guides the service and supervises the team, an employment support professional. They help the individual with job development and job search and follow along supports, an employment peer mentor who supports the member with their lived experience, and a benefits counselor who helps to dispel the myth that gaining employment will equal a loss of benefits. The benefits counselor is really unique and important for the folks that we serve. Excuse me, I am fighting a cold, so I apologize. Give me one sec. All right. So the benefits counselor is very important for the service. They help individuals understand how their benefits will be impacted if they gain employment. A lot of the folks that we work with have worked really hard to get their benefits and their Social Security, and they're really afraid of losing it. And in a lot of cases, they can work a certain amount of time, make a certain amount of money, and their benefits would not be impacted. So the benefits counselor can really look at that unique situation for each member and help them understand, how their benefits will or will not be impacted so they can make an informed decision about working. And then there's a program assistant that supports the administrative needs of the team. Next slide. This next slide is really, really important to IPS services and to the fidelity model. IPS teams have a zero exclusion criteria, meaning that readiness factors will not disqualify a beneficiary from engaging in employment. Readiness factors may include active substance use, criminal background, mental health symptoms, treatment and medication adherence, personal presentation, medical conditions, access to transportation. So it's really, really important that everyone understands these things that may be going on with someone might be experiencing is not going to prevent them from being able to seek out employment. We all can, have our own biases at times. Someone's not on their medication and they're actively having symptoms. They're not ready to work. But really, the employment is an intervention. It gives them 4 hours of structure in their day. It gives them somewhere to have to be in the morning. They're building their natural supports. So we don't want to apply our own biases about someone's situation and their readiness for employment. And we really have to be careful too, because if we are applying those biases, like the example I just gave, like, oh, they're, actively symptomatic and not taking their medication, then, I'm really at risk of discriminating, right? Because they have a mental health diagnosis and now I'm saying they're not ready to work because of their symptoms. So we really need to be aware of that. Okay, next slide, please. So this is the NC Core milestone payment model. We talked about this earlier. So it is North Carolina Collaborative for Ongoing Recovery Through Employment. The entire state, so all 4 plans are operating under the same NC Core model. So it is not funded fee for service. When you look at clinical coverage policy 8H-2, you're going to see, 1 unit equals 15 minutes. And that's not how it's funded. It is funded by outcomes. So outcome-driven reimbursement through milestones. So we'll talk a little bit more about that on the next slide. It's also important to know that it is braided reimbursement between the health plan and the Division of Employment Independence for People with Disabilities. So that is now EIPD, which was formerly Vocational Rehabilitation, DVR. And then another unique thing about IPS is that it does not require prior authorization. And just another reminder that the NC Core model is not referenced in clinical coverage policy. Okay, next slide. Here's a very brief description of the different milestones. So milestone 1 is engagement with informed decision making. So the IPS team works with the member to make an informed decision about, yes, I want to work towards employment, or no, I don't think I want to do that at this time. Once that decision is made, they can bill Trillium for milestone 1. Some of our folks, like I said earlier, has a lot of hesitancy. They've been told, for a long time that they can't work, that they're going to lose their benefits. So some of that engagement can take a while. The next milestone is collaboration with the career profile. The career profile is a 20-some page document that really outlines, everything related to employment for the individual, past employment, education, natural supports, goals, whatever. It's 20 some pages of laying out a plan to help them achieve their goal. And so once that first initial career profile is completed, they can bill Trillium for that. So that's the next milestone. So really, milestones really drive to an outcome, right? If they weren't to complete the career profile, they would not be able to bill for milestone 2. The career profile is a living document, so it is updated throughout services as the member, changes, grows, whatever changes, they're updating it consistently. Milestones 3 through 5 are funded by EIPD, and this is around 3 days on the job, 30 days on the job, 60 days on the job, really getting stability on the job and needing less supports from the IPS team. Milestone 6 is long-term job retention. So that is a monthly payment for when the individual is maintaining employment and the IPS team is seeing them at least once a month face-to-face. Milestone 7 and 8 can be, don't have to go in order, and they can be optional. If someone has a career advancement, so they go from working as a receptionist at a hair salon, and now they are moving up to being able to cut hair. That might be a job promotion, and the IPS team supported them with that, and they would be able to bill Trillium for that career advancement for that member. An educational advancement, we gave the example of those folks maybe going to school to help support their career goal. So as they make accomplishments in their education that the IPS team supports them with, they can build Trillium. And then vocational recovery and independence is the final milestone, and that's when a member is ready to discharge and they've achieved their treatment goals, their service goals, and they are ready to discharge and no longer interested in IPS support. All right, next slide, please. Okay, so one of the nuances with IPS services now that it's covered under 1915I is that the individuals have to have an assessment to determine eligibility for access to 1915I services. So in the past, provider could just refer to an IPS team and they could, start engaging the member. Now the care manager has to do the 1915I assessment first. They have to submit it to the DHB contractor to determine eligibility for 1915I services. And then once that member is approved, the care manager has to do the care plan. And the care plan has to have the employment goal for IPS services, the milestone information, and the care plan is the service order. So IPS teams cannot really engage with individuals until this tailored care management process happens. All right, next slide, please. I want to talk a little bit about IPS services and the transition to community living initiative. So in 2012, there was a settlement agreement between the United States of America and the state of North Carolina. And it was around individuals with serious mental illness who were being who are residing in adult care homes and not given opportunities to be integrated into their community. And so the Transition to Community Living Initiative has been in place since 2012. And the state of North Carolina is really working to ensure we are accomplishing the requirements of that settlement agreement. And IPS services is one of the focuses of that settlement. They want individuals with severe and persistent mental illness to have the same opportunities that folks without disabilities have, and to have the same opportunity for community inclusion if they choose to. So we have a lot of focus on IPS services due to the settlement agreement and ensuring that we are not discriminating with our own biases, that we are giving folks the opportunity to work and explore work if they choose to. All right, next slide, please. Okay, so this is my last slide. IPS is tricky in several ways. We have a fidelity model, we have a clinical coverage policy, we have a payment model that is not linked to the clinical coverage policy, which makes it a little bit confusing. IPS for 1915I has to go through that care management process first before the IPS teams can provide the service. So there's just a lot of moving pieces with IPS. We have a whole team. My team is dedicated. I have 4 staff and a manager that directly support IPS specifically. And so we're happy to help any way that we can, but really, encourage you all to work with the individuals that you're working with and, instill hope about employment, have discussions about employment, really be aware of any perceived biases you might have, and, start building hope for the folks we work with and getting them really integrated into the community. So I think that's it for me. Yeah, so next up is Katie Eads.
Thank you, Katie. I'm Katie Eads, and I am the Clinical Support Director here at Trillium. Next slide, please. So I'm going to be talking a little bit about non-emergency medical transportation, or NEMT. And so just kind of and this is more of a refresher. So non-emergency medical transportation, or NEMT, and then non-emergency medical transportation, NEAT. Actually, I just realized that was wrong. Provides transportation to members for medically necessary covered services. It's important to recognize that this is only available for tailored plan beneficiaries. And so if a person is Medicaid direct, or also is part of the Eastern Band of Cherokee Indians tribal option for members, that beneficiary would go to their local DSS department to kind of coordinate and provide those NEMT services. I did also hear there's a link for just kind of information on the DHHS side in regards to NEMT, and then also a link to our Trillium webpage, which has a brochure on NEMT, which also provides some really helpful information. Next slide, please. So what I'm going to do is I'm going to just be covering some of the commonly asked questions that we have in regards to NEMT. So kind of one of the first ones that we get is, what number do members or care managers or providers call to help schedule non-emergency medical transport or NEMT? And so obviously the number is listed there. And when you call that number, you will hear a menu of options, and you press the prompt that says transportation. And after you press that prompt, you'll be connected to ModivCare's NEMT call center. And then you can use, kind of say a variety of things, whether it's, you want to schedule a ride, or you also can say, where is my ride? My ride's late. And so, depending on what you're needing, you can use a couple of those different options, but that is the number that you call to reach ModivCare. Next slide, please. So some of the questions that we get too are surrounding, like, where can ModivCare or NEMT take me? And so like, such as, can they take me to the grocery store? Can they take me to court? Can they take me to work? And the answer is no. NEMT is a benefit that provides transportation to people who are going to a Medicaid covered service where transportation is not provided, and or there are times where, like, say someone needs, you can also use it to go to the pharmacy to pick up medication. So, if you have a doctor's appointment or a dentist appointment, or not dentist, if you have a doctor's appointment and or you're going to therapy or whatever that is, NEMT can be used to provide that transportation and also be used for going to a pharmacy. Next slide, please. So some of the other questions, can they receive gas vouchers? And so we cannot receive gas vouchers. However, people can be reimbursed for transporting. And so what will need to happen is, for this to occur, there has to be a call to ModivCare to alert them that, there's a appointment that's going to be had, and, either the family member or, even a friend who's providing transportation will need to be reimbursed for that mileage. And so, and I, kind of, it says they need to document that this trip occurred and that they're aware of it. And then there are reimbursement forms that can be found on ModivCare's website. I put the link right there. And so there are forms that can be printed out and manually, handwritten in. There are forms that can be typed in, that can be emailed. So there's several different ways for which a form can reach ModivCare. It isn't just one of those where, there's only one way, whether you mail it, fax it, email it. There's several different options. Next slide. Other question, do minors have to be accompanied by an adult? Yes, they do. ModivCare cannot transport any minor without having an adult accompanying them. And that is a mandatory rule. There is no exceptions for that whatsoever. The other question is, can more than one person accompany a member to appointment? So say, you have a minor who is going, and then you have, and their parent who is, needs to obviously accompany them, but maybe the parent has a brand new baby and needs to bring the baby with them. That is a something that can be brought to ModivCare. And so, when the ride is being scheduled, that's a conversation to have when the ride is being scheduled, to say, hey, I need to schedule this ride for my son going to his therapy appointment or his doctor's appointment. And, I'm a new parent and we have a baby, and I need to have a additional person attend. And so they will review that and then let that person know and make a decision on whether that, the parent can bring an additional person along. Next slide, please. So what would happen if there needs to be some special need or request, such as the member might need assistance getting in and out of the car, or a member has been using a particular driver for a really long time and would like to continue with it, or the member needs a specific type of transportation. And so these are all things that, just kind of similar to the example I talked about on the previous slide with the adult needing to take another person with them, is these are all things to talk to motive care about when scheduling that ride, and say, hey, whether it's this person needs this person's in a wheelchair, they're going to need a wheelchair accessible van, or this person really wants to use this, if all possible, wants to use this driver because they have been using them for a very long time, they feel most comfortable with them, or whatever that reason is. But these are all things, when the ride is scheduled, it's important to have that conversation at the time of scheduling the ride, not the day before the ride or anything else. This is all part of that kind of conversation. And the other thing is, like, what do you do if the person has a bad experience? Motive care wants to know about those. So you can always call motive care and kind of provide that information. It's always best to be able to say, like, if at all possible, have the driver's name available. If that person doesn't know the driver's name, obviously you need to kind of share the date and the time of the trip, and that's information that then motive care can say, okay, we see that Jane Doe rode with this driver on this date, and they can kind of narrow it down. Next slide, please. Do I need prior authorization for NEMT? Yes, in the sense of only for times where you have trips over 75 miles, or you need 75 miles one way, overnight accommodations such as and/or like air travel or travel related expenses such as meals or parking. And so those are all things that need to be scheduled in advance when you're scheduling the when you say, hey, kind of like with the mileage, like you have to call and say, I need to do this ride. When it comes to things that are over 7 miles away where overnight accommodations are needed, that is something that you call motive care and get that scheduled in advance. Other question that's commonly asked is, who acquires the prior authorization for NEMT? So motive care will work to obtain any prior authorization, and it's not the responsibility of the member or the care manager. And as I said, they will have to call prior to the appointment to motive care to, say, we have this appointment coming up, we need to do this, and motive care will work to obtain the prior authorization. It's always important to note that for routine appointments, you have to give at least a 2 days notice to schedule that ride, but no more than 30 days. Next slide. And some questions regarding, is there a special number for providers or facilities? And yes, there are. And so those phone numbers are listed right there. I'm not going to read them out to you, and you will get a copy of this slide deck, or the slide deck will be available for everybody. Next slide. Oh, sorry, this is the duplicate slide. So next slide. Okay, so I am now going to be moving over to identifying a member's care manager. Next slide, please. Thank you. So wanted to talk to everybody about this. Trillium has developed a process for when a PCP or a primary care physician office or behavioral health provider need to determine the name of a member's care manager. So you're working with someone, you're like, hey, I think this person has a care manager, or if they don't, they need one, but I don't know who their name is. And so we wanted to have a streamlined way for providers and PCPs to reach out to Trillium where they could ask for that care manager's name. So the first thing we do ask is for you to go into NC Tracks and just see, who that person is assigned to for Taylor Care Management in NC Tracks. So NC Tracks will show who that person's assigned to, whether it's for Trillium, for TCM, or if it's whether it's a provider-based care manager for TCM. NC Tracks is not going to show the assigned care manager's name. It will just show which agency that person is assigned to for Taylor Care Management. So if you, go in there and you're like, hey, I see this person assigned to Trillium, then, your next step would be you can either contact provider support services line via the phone or email to request a form that we have, or you can go to the Trillium website and I have kind of where you go to get that. It's under per providers, resources, provider documents and forms, under care coordination forms, or you can use the link that is here on this slide deck. And so the form is, relatively basic. It has just information on there, member's name, Medicaid ID number, date of birth, the member's phone number, your contact information, things like that. It's really important when you complete this form, there's a section for kind of additional information to provide. And so one of the things that's important is if there's special circumstances with this, while you're making this referral, please, the more information is better. So we, because we do read what's in there. And so anything additional you want to add, very important information. It's always good to add it. Next slide, please. So kind of what's the next step after, you submit this referral form? So what happens is the referral form submitted and the clinical support team will review that PCP provider request for care management name or assignment referral, and will provide a response within 3 business days. The response you receive will really depend on a lot of different factors, such as, are they assigned to Trillium for TCM, or are they assigned to a provider-based care management entity for TCM? And so if they're assigned to a provider-based care management entity, then what we'll do is you will get an email that says, hey, we received your referral and Johnny is assigned to XYZ TCM entity. Here is the contact information for that entity. And we will also provide a link to our website, which actually has all of the TCM providers and their contact information. So that's always there on our website. If the member is assigned to Trillium for care management, then the clinical support team will provide the name of the care manager, and we will also alert the care manager of your request, your referral that you submitted, wanting to know the name of that person's care manager. Next slide, please. There are times where we have people who are assigned to Trillium who do not have an assigned care manager yet. We have members that are brand new to our system every single day that don't have assigned care managers yet. So in those circumstances, you reach out, the person's assigned to Trillium, we will respond to you and say, this person doesn't have an assigned care manager. However, we're going to be submitting this referral for care management services. And we will send you an email to the email listed in the referral form and say, this is what we're doing. They don't have a assigned care manager, submitting the referral. There is a different time frame for those. You will get that initial email within the first 3 business days saying this person doesn't have a assigned care manager. However, once we submit it, the care management team has 3 to 5 business days to review the referral that we submitted for you, and then assign a care manager. Either assign a care, they'll review it and either assign a care manager, or they may deny the referral, which I'll kind of explain a little bit later. And so what will happen then is, if the person is assigned a care manager, we will reach out to you and say, hey, this is the name of the new care manager assigned, and we'll also alert the care manager of your outreach and let them know that, you had submitted this and that was what prompted the referral. It's really important to note the care manager is always going to outreach to the member first to get consent for TCM before they reach out to the provider or PCP who submitted the referral. So although they may have a care manager assigned, within, 4 business days, you may not get an immediate call or outreach from that care manager because their first line of work to do is to reach the member first and then outreach to you. There are times where someone may not be assigned, and that could be for reasons such as, occasionally there's someone that we receive that is not assigned to Trillium for at all for and may be assigned to a different NEMT tailored plan, such as VIA or Partners or Alliance, or they may be assigned to a standard plan instead of a tailored plan, or they may be receiving a duplicative service, which means that, when someone has duplicative service, there's a certain services the state says you can't get TCM and this service at the same time. So what we'll do is we will alert the referring person that the referral was declined and provide additional information on why it's declined, such as this person, is assigned to a standard plan. Here is the contact information. Here's a list of information about the standard plan. Please reach out to them. If you have a referral that you feel is urgent or emergent and someone needs to be assigned immediately and you need to have someone really expedited, or you're a hospital and you need to refer a member who is on an inpatient unit or in the emergency department, we request that you contact our member and recipient services line. And I have that number listed right there. And that's and have that referral submitted that way. Because as I've talked about, our process is for just your routine, hey, I need to know Johnny's care manager, name of his care manager, or I heard Johnny doesn't have a care manager assigned, anyone assigned. These are for routine requests. So this is not going to be, you will not get an immediate name of a care manager if someone's not assigned. And so that's where we always ask, if this is emergent or urgent, please go through the member and recipient services line process. Next slide. One thing we highly recommend that you do is alert the member that you're submitting this, especially if that member says, doesn't have a care manager, because I don't know about you, but I do not always answer phone calls that I get from a phone number that I don't recognize. We have that same issue as well when it comes to outreaching to members, especially ones that are brand new. And so if you let them know, like, hey, we talked, and I told you that, I help you find out the name of care manager, you're going to probably be getting a call from the, an agency, whether it's Trillium or whether it's provider based, and they'll be reaching out to you. So you may be getting a phone call from a number you don't recognize. And it's really important to let them know that they may be getting this call, because that can help with the linking and engaging with that member for tailored care management. If you don't receive an email response to your request within 3 business days, we always recommend you check your spam or junk folder. All of the emails that we send have PHI or PII, because we always list, the member's name and either their Medicaid ID number or their date of birth in that email that we send back to you. So there's always sent encrypted. So we recommend that you check your spam or junk folder. If your question is about personal care services, there is a go to the Trillium website. There is actually a link. I put the link right here. There's personal information about personal care services, and then also a process for if you have a question about personal care services, we have a whole process where you can submit a question through a different place. So we just kind of like to do that reminder that this is not for the request for CM name or provider or assignment is not for PCS related type of questions. And I also just here, there's some links for the information on TCM on DHHS's website, and then also on the Trillium website for the provider side of TCM, if you're a provider wanting to learn more about TCM, or if you're a member wanting to learn more about TCM. I think that's my last slide, but next slide. Yes, it is. So I'm going to be passing this off to Stacy Henderson and about submitting IT tickets or IT support.
Good morning. My name is Stacy Henderson. I am the IT Programs Director here at Trillium. I'm going to briefly go over how to access our provider portal, Provider Direct, and review ways that provider agencies can reach out to Trillium IT for tech support. Next slide, please. You can navigate to Provider Direct through Trillium's website and then by going to the For Providers page. There are 2 access points from within the For Providers page. The first is via a hyperlink that is available midway down directly on that page. You can see this in the screenshot on the left with the red circle. Next to that screenshot on the right is the other option. If you scroll down a bit further on that same page and click on the Learn More button in the purple box for provider contact information and portal, this will take you to where you can access either the Trillium Provider Portal or the provider portal for our physical health partner, Carolina Complete Health. In addition, once you are successfully logged into Trillium's Provider Direct portal, you then have access to navigate to Carolina Complete Health's physical health portal via a hyperlink. This is displayed in the figure at the bottom of the slide with the orange banner. Next slide, please. Provider Direct includes some great resources and trainings that you can quickly access by going to the training module, which is located in the green navigation bar at the top of the screen. If you run into any issues while in Provider Direct, we recommend quickly viewing these resources to see if there is a training that can assist in self-troubleshooting. If you're unable to resolve the issue on your own and still need any assistance, you can utilize the feedback button that is displayed at the top right-hand corner of Provider Direct. Additionally, you can contact Trillium's IT department for Provider Direct support by emailing pdsupport@trilliumnc.org. When you need assistance for issues related to functionality within Provider Direct, it is important to only email the PD support email, as adding additional Trillium email groups will result in multiple tickets being created. This concludes my review of accessing Provider Direct and submitting IT support tickets. At this time, I will hand it over to Savannah Griffin with our claims department to discuss third-party billing.
Good morning, everyone. I'll actually be doing this next portion for the meeting today. My name is Jacqueline Thomas, and I'm one of the claims supervisors here at Trillium. And I'm going to be talking briefly today about the process for obtaining business associate agreements and or QSO agreements. Next slide, please. To ensure that all PHI for our members is protected and to make sure that we're not violating anything according to HIPAA guidelines, Trillium is unable to share information or speak with a provider's third-party biller without a business associate agreement in place between the provider agency and the third-party biller. If you are a provider that provides substance abuse services, and you utilize a third-party biller, substance abuse disclosure does require what's called a qualified service organization agreement to be signed between the provider agency and the third-party biller. When a third-party biller calls or requests protected health information, they will be asked by the call staff if they have a BAA or QSO with the provider agency they're calling for, and that information will be verified. A BAA or QSO agreement is actually good for the time period that's listed in the agreement, and that can vary based on the actual agreement itself. Next slide, please. In order for us to provide information to a third-party biller or any caller for that matter, they are required to verify two pieces of information from Trillium's software platform for the provider. Those pieces of information include the NPI number, the federal tax ID number, and the provider name, address, and phone number. The BAA and or QSO will be confirmed before any PHI is disclosed. Trillium Health Resources staff are only allowed to disclose PHI when we have the proper documentation in place. When a third-party biller cannot be verified, they will be informed that information cannot be shared, noting that there is not a BAA and or QSO in place. Next slide, please. And lastly, if you have a BAA and or a QSO agreement, this is the email address here that you can send those documents to. It's claimsupport@trilliumnc.org. And lastly, on this slide, we do have a link here that contains an example of a business associate contract. So you can click on that link to view an example and whatnot. Next slide, please. And I will turn it over to Miss Sarah. Thank you, guys.
Hey all, good morning. I'm going to shake it up a little bit here and just show you my face so you know who you're talking to. I'm not going to stay on video because I know there can be bandwidth issues and such, but I wanted you to see who the voice was, the face was behind the voice. So I'm going to be presenting two topics today, and the first one is expedited appeals criteria. Next slide. So, as you all may know, Medicaid members have the right to appeal when services are denied or partially denied. They also have the right to appeal if Trillium decides to terminate or suspend a current service that has been previously authorized, and they have the right to deny if there is a denied payment of a claim. Next slide. So there are two levels of appeal that members can seek. The first is the internal plan appeal. So that's an appeal with Trillium, and that must be done before any other appeal takes place. So what they would do is request an appeal first from Trillium Health Resources. If after that appeal they're unsatisfied with the outcome, they can file an appeal for a state fair hearing with the Office of Administrative Hearings. Next slide. There are two timeframes for an appeal. The first is the standard timeframe, which is the most common, and that allows 30 days for Trillium to process the appeal. And these appeals should be used for non-emergency situations. And they are, again, the vast majority of appeals qualify as standard appeals. Expedited appeals are processed within 72 hours, and they should be used only for emergency situations, not for situations because you would just like a quicker answer on your appeal. Next slide. So here is the criteria that comes from federal law that you can use an expedited appeal. And you can use an expedited appeal when the standard appeal timeframe could seriously jeopardize, and I highlighted here, seriously jeopardize the member's life, physical health, mental health, or ability to attain, maintain, or regain maximum function. Next slide. So these are just some examples to help illustrate whether an appeal should be expedited. So here are situations that commonly you should request an expedited appeal, a member or a provider helping a member submit an appeal. The first is for life-saving medication. Second, say an organ transplant. This is actually the example that the judge at the Office of Administrative Hearings uses, is the organ transplant, or suicidality. And clearly this is not an exhaustive list. These are just some examples here. Here are situations where probably you are not going to or should not request an expedited appeal. The first one almost always, in fact, I couldn't come up with a situation where you ever would request an expedited appeal. But if your claim is denied for no prior authorization. So what we do see sometimes is that providers will request an expedited appeal because they did not seek prior authorization for a service. They have provided the service, then the claim was denied, and then they want to appeal the fact that they had no prior authorization. So we cannot expedite those. Other examples that probably do not qualify for an expedited appeal, the initial prescription of weight management medications such as Wegovy or Ozempic, usually those are not an emergency situation. A mattress ordered as DME, again, that's usually not going to be an emergency situation, or in the mental health or substance use disorder world, outpatient therapy services, again, are probably not going to be something that requires an expedited appeal. You can see here, I did put a disclaimer. These are just examples. There always may be circumstances under which these scenarios may require an expedited appeal. And so discretion should be used in any of these circumstances. Next slide. What if you don't want to wait 30 days for an answer, or if the member doesn't want to wait 30 days for an answer? There's a couple things to know. The first is what we would promote in almost every situation is a peer-to-peer review. And when the member and the provider receive a notice of adverse benefit determination, which is the denial letter, there will be instructions in there about a peer-to-peer review. The peer-to-peer review allows providers to speak directly to a reviewing physician or clinician and give more clinical information. It usually happens within 24 hours of receiving that adverse decision, and you typically get a real-time decision out of that. So if, for instance, the treating provider is able to contact the reviewer for Trillium Health Resources and say, oh, I'm sorry, in the documentation we didn't cover XYZ, but let me tell you about that. And then the reviewer on the Trillium end is able to say, you know what, with that new information, criteria is met, I'm going to go ahead and approve the service. Then you can get real-time decisions that way. It's much, much, much quicker than going through the appeal process. The other thing to note is that this Trillium average standard appeal time frame, when we actually, even though we have 30 days, what our averages are typically for pharmacy, 3.5 days, physical health 4 days, and behavioral health 7 days. And again, those are our standard averages. So if you remove the expedited appeal request from the calculation, this is what we average for a standard review appeal time. So even though you're not requesting expedited, you typically get a very speedy response and do not have to wait the 30 days. Next slide. Why is it important to correctly request the correct time frame for the appeal that you're seeking? The first is that expedited appeals are more resource intensive. It's more intensive on us at Trillium and on the peer review, the clinical reviewer. It's also more intensive on the member and the provider, because if we need additional clinical information, that must be produced very quickly. We only have 72 hours from start to finish, from the time that request hits our system to the time we send out the notification and notify the member of the decision. We only have 72 hours. So we need to gather materials very quickly for that. So it's more work on us and more work on everyone else involved. So that can sometimes lead to situations that are not optimal for the member. Which leads to this next bullet point. Quick decisions are not always the most informed decisions. So sometimes it does make sense to want a little more time to have that appeal processed. And standard appeals do give members more time to, and providers more time to provide additional information. It's quite common for us to have a member file an appeal and say, I'm going to request a standard appeal. I don't have the additional information yet. I've requested it from my doctor or provider. They're out of town. They're going to be able to get it to me next week. If it's a standard appeal, we're able to say, okay, we're going to sit on this appeal until you can provide us that additional information. Now, if it gets close to that 30-day time frame, we're going to have to consider that and reach out. But it does give us more time, so it kind of slows the process down for everyone to gather the materials that are needed. We really want to be able to approve requests if it's medically necessary. So the more time the member has and the provider have to gather that material to say, here is why we think it's necessary, the better outcomes it is for the member. Next slide. And here just are the resources that I used. If you have any questions about where I got my information from, you can visit these resources here. And next slide is me. I'm going to head into here the next point, which is requesting an authorized representative for a member appeal. Next slide. So again, this is just to reiterate, here are the situations under which members have the right to request an appeal of an adverse decision. Next slide. So who can file an appeal? Members can file an appeal. Guardians can file an appeal. Providers can file an appeal on behalf of the member with written consent. Similarly, it does not have to be a provider. It can be any authorized representative. A provider is just a type of authorized representative. It could be an attorney. It could be your neighbor. It could be your spouse, the member's spouse, whoever the member deems is authorized to represent them in the appeal can be an authorized representative. But that must be, the authorization must be given with written consent. And this comes directly from the Code of Federal Regulations. So this is not state law, I'm sorry. This is federal law. So what it says, if state law permits, and I've emphasized here, and with the written consent of the enrollee, a provider or an authorized representative may request an appeal or file a grievance or request a state fair hearing on behalf of the enrollee. And North Carolina state law does allow authorized representatives. So with written consent, an appeal can be filed with an authorized representative. Next slide. So what is accepted as written consent? So I've given here, this is an example of the form that you will receive with the adverse benefit determination, the denial decision. The appeal form at the bottom of that appeal request form is a section where the member can authorize someone to be their representative. This is probably the easiest way to get a member to authorize someone in writing to be a representative. And they or you would fill out, as a provider, would fill out the portion there where it says name of representative, relationship, etc. And then that needs to be signed by the member or the legal guardian. Now, this members and providers do not need to use this form to request an appeal. This is just an example of a way you can request an appeal. Again, it's probably the easiest way because the form comes right with the denial notification, but we can accept appeals in other written forms for authorized representative. So if it's not this form, just make sure that whatever written authorization is given names the person who is giving consent, then who they are authorizing to be their representative. So not only their own name of the member, but also, or the guardian, but also the name of the person that they are allowing to file the appeal on their behalf. And then they must have a valid signature, again, of the member or the guardian. Next slide. So what is a valid signature? So this comes from the Records Management and Documentation Manual that's published by NCDHHS, and the appeals must follow these requirements. So a handwritten signature requires a handwritten date by the signatory. An electronic signature is is the attribute, affixed to an electronic document to bind it to a particular party. An electronic signature shall include a date stamp. So you can see here, here's an example of my electronic signature that was produced on a PDF. So a PDF is one way you can do it. You don't need fancy software like DocuSign or anything if you're going to use an electronic signature. This is one way that you can do it. Next slide. So what is not considered a valid signature? You cannot just type the name with a fancy font that you found in Word or another word processing software program. So this is an example again of my signature that I typed in Word using a font that was kind of flowery. So that is not considered a valid signature there. It also cannot be just kind of a scribble that a provider fills in to kind of look like a signature for the member. With authorization requests, we receive a lot of documentation. That documentation very often has the member's signature on it or the guardian's signature. If we are suspicious that a signature does not look like a valid signature, we will cross-reference it with other documentation we have to see if the signature seems valid. And I did not add this to the slide, but it's a good reminder that forging signatures is considered fraud. And so we would potentially send that case on to our program integrity department, our special investigation unit, for further investigation if we suspect that someone has fraudulently signed someone's name to a document. Next slide. So if we believe that the signature may not be valid, or we suspect it may not be valid, we are not trying at all to restrict the members' right to appeal. Again, they have the right to appeal. We want them to appeal if that's what they wish to do. So we will make attempts to contact the member to validate the signature. We recognize that a lot of times providers are just trying to help out. If they send us documents as the authorized representative but don't have a valid signature, sometimes we realize it's very hard to get up with members after they've perhaps left your care, or even if they're in your care but you don't see them daily, it can be very hard to catch up with them. We realize that. We are not trying to put barriers in front of anyone. This really, like I mentioned, is federal law that we have to follow. So we will make an attempt to contact the member to validate the signature. If we're unable to validate the signature by contacting the member, the appeal request is considered invalid and we will not process it. If we contact the member and they say that, no, I didn't sign that, but I would like this person to represent me, what we will do is we will take a verbal appeal from the member. And then if the provider has submitted materials already, we will then take those materials and consider them as additional information that we will use in considering the appeal. We will now consider it a verbal appeal that is filed by the member, and that any information that was submitted by the provider is just additional information that we will consider during the appeal process. Next slide. And again, here are my references. If you have more questions about where this information came from, you can refer to these. Next slide. And I am now going to pass it on to Jessie Harden, who is our Senior Director of Communications and Training.
Hi, good morning, everyone. Thank you so much. So we'll start out with some reminders on the Physical Health Secure Provider Portal. If you haven't already, we do encourage you to sign up. It's a free account, provider.trilliumhealthresources.org. If you haven't yet, click on Create New Account, and it'll walk you through the prompts to verify your email address. You'll get an email sent to you with a verification code, and then you'll come back to the screen and proceed with the login page. Next slide. At that point, what it will do is prompt you to enter the tax ID number, business phone, and fax for the agency that you work with. The TIN is pretty crucial here. It's really verifying the TIN against our back-end systems to confirm that you are with a contracted provider. So that is really important. Also to take note here, if your practice does not yet have an account manager set up, Once you hit submit here, we do ask that you email our provider engagement team. I'll make sure everybody has that email address, and let them know that you need to be set up as the account manager, and they can do that on the back end. Basically, our team is responsible for setting up that first account manager, and then thereafter, the account manager is able to add and remove subsequent users for your agency. Next slide. So here, this slide is really just to summarize those steps in one view, so you can refer back to this page for your reference. With that being said, if you already know that your practice has the account manager set up, you can simply work with that person and they can validate your request so that you are able to log into the portal and have full access to all the features that you need. Next slide. So as I mentioned, the account manager is an important role. Their primary responsibility is to manage the users for the organizational TIN. And for that reason, we do recommend at least 2 people be assigned as account manager at your agency or organization. There's no limit though. You can have many more account managers if you wish. For instance, for large health systems, there may be 1 or 2 account managers per department. So whatever suits your needs. Again, our team is responsible for getting that first account manager set up and verified for your tax ID number portal access. And then thereafter, each additional user should walk through that same process of creating the account. And the account manager is then responsible for verifying their request and giving them access to the portal. Next slide. We also understand that many providers work with third-party billing entities, and they too can have access to the portal. It would be a really efficient way for them to view claims and payment history and submit claims in the portal. We do ask for the account manager for your practice to start this process. You can do that by logging into the portal, and you'll see user management right on the home page. From there, you'll invite a user where you're simply going to enter the email address of the individual from your billing entity here. That'll generate an email to their inbox where it'll bring them to that page to create an account, and then returning to that login to enter the TIN for your agency and the phone and fax. So again, that TIN is really crucial. So if you are an account manager granting access to a third-party biller, I would be prepared to share the tax ID number with them, and that is based on the TIN that you are contracted with us for Trillium Physical Health Tailored Plan. Next slide. So shifting gears here, we like to always review claims denial trends with you all. And this is again for physical health tailored plan claims. You probably won't see much difference here. They stay pretty consistent. However, we'll walk through a few of these. The first is that there was no authorization on file that matches the services billed. So authorizations are granted at the CPT code level. So if there is a CPT code on your claim that an auth is required for, but there is no auth on file, that claim will be denied for that service. We do recommend that you check the Trillium pre-auth tool prior to rendering the service. We've linked it here where you can enter the code of the service that you would like to check. And we do have additional prior auth resources online linked here. And then if you have any questions, you're welcome to call the member and recipient service line or the provider support service line listed here as well. The next has to do with coordination of benefits. We know that there are members that may have a primary insurance payer, and federal regulations do require that payer to be billed first, and Medicaid is the payer of last resort. We do have a provider guide on how to submit a COB claim on the Trillium Physical Health portal, so you can refer to that for pretty good details on how to successfully submit a COB claim. Next, we have the denial about the service or service modifier combo not found on the fee schedule. So the easiest place to confirm covered services and modifier combos is at the NC Medicaid Service Now page for fee schedules. They've really updated this, so if you haven't seen it, I encourage you to check it out. You can simply enter the code of the service that you'd like to check, and it'll indicate for you if it is a covered code by Medicaid, Medicaid managed care, all of the PHPs, tailored plans, and you can also search for modifiers. And so we do adhere to that for physical health claims processing, so that would be the best source of truth. The next two I'll combine. They are very similar. It has to do with either the NPI or perhaps the taxonomy that was submitted on the claim, that those numbers are actually not active on the Medicaid file. This refers to the Medicaid credentialing file called the provider enrollment file that we receive daily from North Carolina Medicaid. And that's the source of truth for provider data. And it's a direct reflection of your provider data that's entered on NC Tracks. So the most important takeaways here are that you should always ensure that your data has active credentialing with NC Tracks and that what you put on the claim matches what is in NC Tracks. If there are discrepancies, that could cause delays or denials with your claims processing. With regard to taxonomy, we've linked a provider guide here that walks you through exactly where to place that on the claim for professional and institutional claims, both with EDI submission or on the CMS 1500 or UB04 form. So hopefully that is helpful. Next slide. All right, on to PCS billing guidance. We're going to spend a few minutes talking about personal care services and some important updates for these providers. Next slide. So first, we'll cover some of the important nuances around where to bill your PCS, your personal care services, as a PCS provider. So as you know, there are certain PCS that are held to federal requirements for electronic visit verification. So that includes visit data and claims being submitted through EVV. And that is specific to the taxonomy listed here, the 253Z, and the CPT code 99509 with the HA or HB modifier. If those conditions are met, then the claim must be submitted through electronic visit verification. And as a reminder, Trillium partners with HHA Exchange as the EVV partner. There are several options for you depending on your setup, if you need to do a direct connection with HHA or if you have a third-party EVV that will submit that claim to HHA for you. So we have more information about that online and through our communications if you do need more information about that. There are, of course, a lot of other types of personal care services that are not held to EVV requirement. An example of that are PCS delivered in congregate care settings. So in these scenarios, if you're not held to the EVV requirements, then you do bill through the Trillium Physical Health Portal, which we just reviewed a few slides ago. In February, we did host a PCS provider training, and it was for all providers that might be referring members for PCS, and then also for PCS providers to really hear the details of billing and the different portals available to them, how to view assessments and authorizations, which can be found in the Trillium Physical Health Portal. So we've got that recording linked here, as well as the slides and the Q&A. So if you missed that, I highly encourage you to view that. We had great attendance on that training. It's been a really helpful resource for providers. Next slide. So we've talked about this site a little already when we reviewed our common claims denials, but one frequently asked question that we do get from PCS providers is how to know which service and modifier combo to use. And for that, we do, again, refer you back to the state's ServiceNow webpage. So here's a glimpse of what it looks like. You can search in the covered procedure codes, the 99509 CPT, and it will indicate all of the applicable modifiers. And we also encourage you to review the applicable clinical coverage policy. And this is really pertinent for all service types, not just PCS. But this was a question that we got quite a bit during that training. Next slide, please. So an important update effective April 1st, so this went live last week, is that personal care services for beneficiaries in congregate care settings have moved to a per diem rate setting. And that is specific only to the service code and modifiers listed here. So there are 6 modifiers that this impacts, and only those 6 modifiers. Next slide. So this does change how this type of provider would bill for that service. Previously, you could have entered multiple units per claim line, but now you only should submit 1 line per date of service, and each date of service should have a 1 for the units indicating 1 day. You should also, of course, enter all the other required fields of the claim. This is purely for example purposes. You should bill your usual and customary charges. There is a calculation that was determined by the state for how to reimburse at a per diem rate, and it has to do with the authorization time span as well. We have that available for your reference in our PCS per diem rate change provider communication, but providers do not have to make that calculation on their own. That does happen on the back end when you submit that claim. So I think the most important thing to take away from this, again, is that you should only put 1 date of service per claim line, and you would enter 1 unit for each date of service. Next slide. So as a reminder, we do have communications for our physical health providers being sent out on a regular basis. We also have them posted on our website, which is linked here. If you aren't receiving these for Trillium Physical Health and would like to get signed up for those communications, that SurveyMonkey form is linked here to fill out. And we also host a provider orientation and information session on the fourth Tuesday of every month at 12 o'clock p.m. So you can register for that here as well. It's great for new providers or for existing providers that may need a refresher. And we look forward to working with you on that call and as a provider. Next slide. All right, I'm going to pass it over to Linda Hawley to review the new provider survey.
Well, I hope you're enjoying all of the wonderful presentations that we have for you today. And most of the topics that are on the agenda are based on the provider survey that we did last fall. In order to continue to make sure we have the most relevant presentations of education and technical assistance, if you go to the next slide, we are going to be doing a new provider survey. So who can participate in that survey? All of our contracted providers. We are going to post this on our website. We'll also be talking about it in an upcoming provider forum. So you will see that in our network communication bulletins that will give you the link. It'll be on our website, and we'll also have it in an upcoming provider forum. Why does your input matter? Because these meetings are for you. The purpose of these meetings is to provide education and technical assistance and give a time for you to ask questions about items that your agency has. So please participate in that provider survey. We'll give you more information about exactly when it's coming out, but we did want to let you know that your input does matter. And the drive for the agenda topics comes from the feedback that we get from our provider network, as well as if we get a trend in a certain type of questions at Trillium, that we want to make sure that all of our providers have those same answers. So we look forward to your feedback in the upcoming survey. Next slide. I'll turn it over to Kim.
Thank you, Linda. My name is Kimberly Wagner, and I just wanted to review some resources with you. All behavioral health contracted providers are assigned a provider relations and engagement coordinator as your first point of contact for any questions. When you receive this, you'll be able to click on this link, or you can go to our website on the For Providers page, and you'll be able to find the link to that list there. Also, I know you've already heard, but we do have a provider support service line that is available Monday through Saturday, 7 a.m. until 6 p.m., including federal holidays. Also, email is available through network services support at trilliumnc.org. When you create an email or send an email to that email address, it generates a ticket. So you would receive a ticket number back from that email. And then, of course, our website at trilliumhealthresources.org. Encourage you to really go out and take a look. There's a lot of information, and we do update that quite often. Next slide. And then you're here today, so you registered for this forum. So we want to just let you know that the information from the forum that we had, our first one in February and then the one in March, that information is available on our website. If you go to the For Providers page, and then under if you go to the For Providers page, and then you'll be able to see over on the right hand side under information, it will say Provider Forum. If you'll click that, then you'll be able to look at the recordings, listen to the recordings, and view the information. The slide decks are there, also the Q&A from each of those. Okay. And then that segues right into Q&A. I know that there are some questions that have been asked that do not yet have answers. Please know that some of these we will need to take back to our subject matter experts. If you did not receive an answer to your question, you can please, or if you would please put your contact information in that Q&A, and then we'll be sure to answer those questions for you and get that out to you. But at this time, does anyone have a question that they would like to ask?
And I think, Jonathan, do they need to raise their hand so you can take them off mute?
That's correct. So participants can raise their hand and I will send an unmute request to you. But there's no raised hands at this time.
Right. Okay. Right. Again, if you could put your contact information in the Q&A if you did not receive an answer to your question, that would be greatly appreciated. We thank you for your time today and look forward to seeing you next month at the next forum.
Oh, Kim, let me cut in.
Oh.
We did have one hand come up.
Oh, okay, great. Go ahead.
So Donna Roberts, I'm going to unmute you.
It wasn't discussed today that I saw, but I wanted to get follow-up on some things that we've talked about. The IDD innovations, you guys did put in that we have a pass-through again, which is fine, but the reasons for the pass-through have not been discussed, like the issues with getting the plans, the issues with care management, and the CLS authorizations, and just wondering where that is in getting resolution and having us come to the table and talk about with IDD providers, you know, how this can work going forward.
Okay, and I don't believe that we have anyone on the call right now, but we can certainly take that back.
And I asked the same question last month. So can we have somebody on the call next month that can address those things?
It's IDD pass-through?
No, the issues with innovation waiver and providers getting the documentations in time to submit the authorizations, the CLS bundling of services. It was quite a large conversation in the first provider meeting that we had in February.
Okay, thank you.
This is
Yes.
Shan, UM Director for Behavioral
Oh,
Health.
hi.
The CLS bundling of services, it is just the setup of TBS, so there's no changes that we can make for that. And that's the answer that I can provide today. I'm not able to provide information on who submits authorizations from a UM perspective because UM doesn't define that. So I'm not able to help with that, but I can give you information on CLS.
Yeah, there was a much larger conversation in February regarding that with the inability to actually provide the services with the units being EVV and non-EVV and how the actual services are provided. And 2 of the 4 MCOs bundle them and the other 2 don't bundle them. So everybody's handling it differently.
Yeah, thank you. And I wish we could do it something different and as a TBS setup issue. So I guess I can get Kimberly, if you can shoot me that other question related to this, I can try to answer it. I thought we had provided that answer, but maybe I'm mistaken. So thank you.
Will do, Sham. Thank you.
Thank you.
And next up, we have Tiffany Fox.
Question. Our agency has been sending emails to our network provider and other different provider specialists to apply for the CABA process. This has been over 90 days. So is there a direct person we need to speak with, or is that process still active? Is there an updated status?
Linda, will you ask your question again, just to make sure we capture it?
Yes, the question is, what is the process for an agency to apply for the CABA status? Our agency has been trying to sending emails, requests for the past 90 days to different, our network specialists and different other contacts, and we haven't heard anything.
Okay, if you can put your information in the chat, we'll capture that. In the Q&A, we'll capture that, and we will have somebody follow back up with you.
Okay, thank you so much.
Sure, we don't have somebody on. I was scanning the panelists. We don't have anybody on from the department that handles that. And Donna, if you can put your email in the, your name and email in the chat, we'll have somebody follow up with you to make sure we capture your complete question. Jonathan, do you see any other hands?
One more just came up. Megan McDonald.
Wanted to ask, and I don't think anybody will be on the call for this specific question, but I did want to ask it. It's in regards to the EVV service codes. The T2013TF, I know, is one of the codes that is required to go through EVV. I've been seeing different things about service locations. So if it's done in the home only, it's required to go through EVV. So kind of want to know what the process is if these services are rendered in the community. I read where the vendor, HHA, should have a process. I've followed up with them to see how they capture these services that are in the community. So just some clarification on basically how we're supposed to bill and capture services that are rendered in the community with the T2013TF code.
Do any of our folks from our claims department have any response for that, or do we need to take it back?
That would be something that we would have to take back.
And I know we kind of mentioned this topic on the February Q&A, question number 3 on the Q&A answer. Just double check that on our website, where we kind of went into clarification of the T2013 TF and the T2012 and when to bill it for EVV. But if that still does not answer your question, definitely let us know.
Thank you.
Thank you, Chauncey.
Any others?
No new raised hands.
Okay, we do have about 6 minutes left if anyone has a question. If not, we'll wait about 30 seconds and then we'll end for the day.
Cassidy Price, can you put your email address in the chat? I see you just put a question so we can be able to get your response back to you.
Do have a hand raised from Wanda.
Okay. Wanda, are you able to ask your question?
Hear me now?
Yes, ma'am.
Okay. I was asking it, and I guess you couldn't hear me. I was saying that we've had issues mainly with obtaining authorizations for 1915I services. We hadn't had that problem with the innovations waiver services. Has anything been done to address that?
This is Shan, the UM director on the behavioral health side. We're aware of the recurring issues with the 1915I authorizations. We are working on that. We do not have a solution at this time, as it is one, as we discover it, we are working as hard as we can to get that fixed. That is not a great answer, but is the honest answer at this time.
Thank you.
All right, Jonathan, are there any others that you see?
Nope, no new hands.
Okay. All right. Thank you for joining us today. We appreciate your participation and your questions, and we will be working on getting those answers out and posting them on our website as soon as we can. Thank you all and have a great day.